Congratulations again to the winners of the new venture competition. It gives me great pleasure to welcome our afternoon keynote speaker, Dr. Agnes Binagwaho, the Vice Chancellor of the University of Global Health Equity and former Minister of Health of the Republic of Rwanda. Professor Agnes Binagwaho is the Vice Chancellor of the University of Global Health Equity, an initiative of partners in health focused on changing the way healthcare is delivered around the world by training the next generation of global health professionals who strive to deliver more equitable, quality health services for all. She is a Rwandan pediatrician who completed her MD at the Université Libre de Bruxelles and her MA in Pediatrics MA at the Université de Bretagne Occidentale. She was awarded an honorary Doctor of Science from Dartmouth College and earned a Doctorate of Philosophy from the University of Rwanda College of Business and Economics. She worked 20 years in the public health sector in Rwanda. From 2012 to 2016, she served the Rwandan health sector in high-level government positions. First as the Executive Secretary of Rwanda's National AIDS Control Commission, then as Permanent Secretary of Ministry of Health, and then for 5 years as Minister of Health. She is currently a senior lecturer in the Department of Global Health and Social Medicine at Harvard Medical School, an adjunct clinical professor of pediatrics at Dartmouth's Gisel School of Medicine, and a professor of pediatrics at the University of Global Health Equity. Professor Binagwaho served as senior advisor to the Director General of the World Health Organization, and since 2016, she has been a member of the United States National Academy of Medicine, and since 2017, a fellow of the African Academy of Sciences. Professor Binagwaho has published more than 150 peer-reviewed articles. Please join me in welcoming Professor Binagwaho.
It's the first time I go on stage with this as a companion. That's great. So thank you. Thank you for the kind introduction. Good afternoon, everybody. Do you hear me if I'm moving? Yeah. So we are going to spend 45 minutes together. And to a friend who are asking me, you are going to talk about the health sector in the business schools. What are you going to tell them? And I told them an answer. Everything is business. Everything. I'm going to discuss with you how we have built a health sector in Rwanda with an entrepreneurial spirit. And this is the house of entrepreneurship, isn't it? So that's what we are going to do together. I'm going to talk about the public sector. We just come, and there was almost a quarter of this room in another great panel talking about the private sector. Who are there? Yeah, can see. So I'm going not to talk about that. It was a very great panel. So, fixing the fundamentals. Why fixing the fundamentals is because I really believe that you need a business approach, an entrepreneurial spirit to build something. And if you do that with a patient-centered approach, but more than that, an approach centered to the most vulnerable of your society, you can never be wrong. It works. So, I'm not going to insult you believing that you don't know who Rwanda is, that you don't know the statistic of the country, but there is something I like you to remember because it will come back, and there is no light with this thing. Oh. So, I'm too short to go there. But I just want to say that in Rwanda, we don't have $800 per capita. And I want to emphasize that for my brothers and sisters from Kenya, Uganda, Tanzania, Ghana, and I can continue. Because with the approach I'm going to share with you, you will see that money is not what counts. It's the way you do business that counts. I think we are in trouble. You are witness that I'm pushing the right button. But nothing happened. Yes, now it's going too fast. I just want to remember you that Rwanda was totally destroyed 26 years ago. No trust, no infrastructure, health professional killed. We had to rebuild everything. But keep in mind also that people who say it's because you had to rebuild everything that you make it. Just tell them and refer them to all the genocide that the humanity have faced. Genocide is not a building block of progress. 94, we were in the bottom. Life expectancy, GDP, down. I want to recall that when the country is destroyed by something, it happened. Recalled Sierra Leone and Liberia after the Ebola outbreak. They lost 2/3 of their GDP for the next year, isn't it? But we decided in 1994 to take our destiny in our hands. At least we have great leaders who have decided that. And bring back the refugees that were in Congo to avoid to happen what happened to Israel with people so unhappy that unrest is forever. And we apply principle of development that have brought us with a life expectancy that is higher than our sisters' country that have higher GDP, higher budget, more income, more natural resources, more people educated, more schools, more doctors, more nurses, less community health workers. We have double life expectancy. We have decreased cause of death of children under 5 by more than 75%, and reduced maternal mortality more than 80%. I take those claps and bring that home for my community health workers. But also, 91% of our women are delivering in a health facility. Not only with nurses, but in a health facilities. So that means you work on transport, on awareness, on education, and on infrastructure. However, we still have a long way to go. Because if we reach 70 years of life expectancy, I still believe that our people are missing 25 years of life, because we will stop the day we reach 95 years of life expectancy. Still a long way to go. This is to show you the dramatic decrease of maternal mortality, coming very high to better than our sisters' countries. And many will say it's a development problem, but it's not only a development problem. It needs a mindset shift. A mindset shift in the way you provide care, how you provide care to who, but also a political mind shift, a civil society mind shift, a citizen mind shift. And for reach there, you need to have policies, strategies, planning based on data, evidence. To have data, you need to cultivate the willingness and system that collect data. Wrong data are the worst thing to have. So you need to teach people what good data are, how to clean the data, how to use the data, not for the central level, but for the decentralized level, for the people who collect the data. You need also to be open to innovations. You need to, with entrepreneurial spirit, people love to say that we take risk. But in fact, we don't take risk. The biggest risk we have is doing nothing. So, but you need to be open and put the dot together when you have innovation opportunities. We have a zipline in the room, isn't it? So, we saw the opportunity of flying blood when we have bad season, bad roads, and save women that were dying there that need 3 hours to get the blood. Now, 30 minutes, they get the blood. Those innovations, it's just an example. You need also to see all the opportunities you can have with cell phone and giving them to community health workers, help them to ask questions, to be educated, to report, help you to organize your health sector. And whatever you do, never wait sustainability to save life, but always have sustainability in mind when you bring something new. Meaning create the room for this to be sustainable, but also create the room for this to be equitably distribute. So how we did that, I'm going to go in the details. First of all, the leadership. Fight corruption, it's something we know, isn't it? It's something we need to know. But we don't have only the corruption inside the country. In the previous panel, we talked about the brain drain, how 10 countries in Africa have lost $2 billion by educating doctors that now are working in a country like this one. And this country take them and welcoming them without paying a penny for their education. That is global corruption. And there are so many examples. We always point the finger on us, Africans, but the fingers need most of the time to be pointed elsewhere. And corruption has always two hands, the one who gives and the one who receives. Isn't it? We never vote for corrupt government to receive aid, pretending supporting health sector and going somewhere else, isn't it? So corruption, we have a lot to do. So when I say also citizen-centered services system, that means the community. Participatory process. We have now, up to last year, we had 45,000 community health workers. Now we have 18,000 more. So we have more than 50,000 community health workers, 4 per each village, that have some function. There are one that are follow the pregnant woman and the children under one. There are one who follow early child development. There is 2 who follow common disease and treat them. And with this, that's how we have those drop. Because task shifting is also a system of organizing the health sector, isn't it? We have community health workers that prescribe antibiotics at community level, and they are doing that so well if you have to educate them. You have nurses who do the work of doctors, not everything, and you have doctors who do the work of a specialist, isn't it? All countries, who is doing the C-sections? MDs, who is who repair broken legs, MDs. And you have few specialists that come above. But most of all, you have collaboration between the central level and the decentralized level, but also between sectors. The health sector can do nothing if there is no road that allows people to come and get care. We can do nothing if there is no peace and security. We can do nothing if the workforce will not be replaced, educated, even if this country is stealing them. So we need education, transport, security organ, gender, and family working together to build the health sector. 1994, we could have done like those very traditional people and do business as usual and pray God to have another result. We didn't. We did what I just told you, going for capacity building, evidence-based, innovation, accountability, stop guessing, and stop going for ideologic approach. Big movement of peace and reconciliation. And thinking that in the heart of the worst person who have done the worst thing, you can change it and tomorrow make that person the best person acting for developing his country. It takes courage. It takes courage for the people who have suffered of the genocide to go to this approach. But without this approach, we will never have made the health sector or the education sector or the security sector that we have today. So we apply now, and with Paul Farmer, we have put some science behind what we did. That is implementation science. And I'm going to develop with you the 5 S that are needed to develop a health sector. First of all, that's it. You need to know your environment. As we say, the social determinant of health now is known, totally neglected, but totally known. People, if they don't eat, they will not take their drugs. If you don't give access to all the family, they will share the drugs, isn't it? And create resistance. If you are not there when they need you, they will no longer call on you when they need you. If the law is not correct, there is no continuity. So you need flexibility. You need to be humble enough to understand that the true experts are the communities you want to serve. And you can explain to them malaria, mosquitoes, or virus for HIV. You can explain that. But they will not take what you propose, even if it's the best, if they don't understand. So awareness, explanation, and also ask, how can I make it happen? And take lesson bottom up. Knowing your setting. This is so important that for me, many people are coming and say, what have you done? I want to copy. Never copy. It's like you are pretty, you have a pretty dress, and I'm just going to put your pretty dress. I will be ridiculous because we don't have the same physics. Isn't it? Don't copy. Take the model and go and adapt that. Isn't it? Don't laugh. That's what they do when they copy a health sector. They have another setting, they have another culture, they have another way of understand who is the leader in the society. If I had, for example, to do a health insurance in Nigeria, you have some place where the traditional king is absolutely the boss, isn't it? So he should lead the way. All the population will run and have a health insurance if the king say it's a good thing, isn't it? Follow the culture. but have data. Use technology. There was a great panel before about technology and education. Dan is there. You know, did you see the penetration of cell phone in Africa? Isn't it? Thanks God, because I will still waiting for my line. Huh? Isn't it? Now I have a cell phone, I can communicate with who I want. So the new technology will help us to gain time. So that means we need to keep ourselves informed and to learn about it. And absolutely refuse the double standards. We have this that is good for treating tuberculosis in Africa. However, don't try in Europe because it's not efficient enough. Isn't it? And we create resistance that harm our people, that harm even public health globally. So apply the global standard at home and refuse the double standards. Also, I will insist, and you'll see every 3 slides will be data and data. You are young. You are here to be educated. There are some who are less young, like me, who are certainly grandpa and grandma here. But write. Write your experience. They have said that I have published more than 150 articles. It's just about what we were doing. And what I do when I write it, allow me to go back in what I was thinking, what I make that was not so good, and allow us to improve. Write. Publish the results. Share them. And when international organization doesn't give the data or the standard you want, don't implement them. Go for science. Call your fellow scientific across the world and say, for my people, I want the best. They will say, too expensive. Just say, the cost of doing nothing is far more expensive. And you go for a cycle where you do, you plan, you measure, you evaluate, you go for data, don't go for politics. We have some results that some leaders are putting in the cupboard because too good or too bad, they cannot explain. Put all the results on the table. If the research didn't bring what it takes, redo the research. And by doing that cycle, what is totally a common one for those who are program implementers, you will implement your sector using science, and this is the basic of implementation science. But what you have to do also, put all the stakeholders around the table. I talked about the community, but also beyond the community, the civil society. Beyond the civil society, the private sector, and other sectors. Everybody around the table to solve. More brain, more collaboration. It takes time, but when we have taken a decision together, everybody will help to maintain it. And if somebody doesn't want, you call that person and ask why. If the reason is good, you call all the stakeholders and say, oh, there is a good idea here. We need to change our plan. And you change. So that the plan you implement is always yours. This is the technology. It's a simple slide, but the circle outside are the cell phone of community health workers. Coming, you have the health centers, the hospitals, and in central, you have the Ministry of Health. All those systems is connected. Every month, thanks to that, you can have the 15th of the next month, you have a full picture of what has happened in the country. You know where something is going wrong. You know where it's going exceptionally well. And you can understand what they have done, and you can understand what they have done and act rapidly. Create a system like that takes time. But when it's done, it makes you fly. So the first thing is to create the system without forgetting the legal framework that go with it. If you create a good system that is not backed up by a legal framework, when you are gone, your system will go. So the best way to be, it's at home and watch TV. You create for sustainability. So when you change something, make sure that the legal framework is following. So that if somebody, because you believe it's the best, if you do something wrong, don't put it in the legal framework. But if you like what you do, you're convinced, put it in the legal framework. Because to change it, they will need the next politician to agree and the parliament. Example, mutuelle de santé. Legal framework, make it obligatory, mandatory for all. Make it mandatory to have a portion of the budget of the health sector, 13%, paying for the mutuelle de santé. And the contribution of each and every one is in the law. That means if somebody wants to destroy it, he has to go and convince Parliament. Not so easy. The next S is the staff. We have talked about the shortage of human resources. We have talked about how our human resources drained for the Western world. But we have also talked about how to task shift, how to put good regulation around this, so that each nurses, each community health workers know how to do. And they have a protocol that protect the patient, but that protect themselves too. We have also great things like program like Human Resource for Health. In Rwanda, we had too few teachers at the medical school to create doctors and the nursing school to create nurses. So we borrow 100 of them here in this country. Using your taxes. There are not so many Americans here, but there are some of them. We use your taxes. And it was money for HIV/AIDS. A good entrepreneur is a good advocate, isn't it? You need to sell an idea. And you need to make the idea good for the person you talk to, so that the person is ready to buy it. Or you have to make his life miserable if they don't want to buy your idea, in a way or another. So we use PEPFAR money, what is for HIV, and we reinforce the University of Rwanda. We were able to produce 100 doctors a year before. With this program that was over 7 years, we are at the end. Now we can produce 300. It's still too low, but it's progress. The stuff is the equipment. When we buy equipment, we have to buy not what is obsolete here, because you will not have spare parts after 2 years. We all know those equipment that are in a container somewhere, just because there is no more, you cannot repair, or because we don't have in the country people who can repair it. So when you buy equipment, make sure that there is an engineer somewhere. It cannot be in Rwanda, but at 1 hour flight from Dar es Salaam or Nairobi or Entebbe that you can call to repair. If not, you lose it, and very rapidly. And building hospitals, the space, that is another S. Do it with geographic equity in mind, so that the people that are far remote can be served. Geographic equity with financial accessibility are key to build a health sector. There was a debate, the previous panel, about trust. People who doesn't come to ask support for health because there is a distrust of the health sector. That's true, may happen. But if a country like Rwanda, where a big portion of the population have killed 1 million people, we have managed to create trust. That means there are principles behind creating trust that we could all dig, learn about, go home and apply. So, this slide is what we have done with the human resource for health. We have created 8 residency, 5 schools of nursing, and tripled the capacity of the School of Medicine. The other thing we have to do, focus, integration, and coordination. In the majority of our country, very good people from the Western world is coming, isn't it? With their whole plan, their whole idea, and what is good for you. And if you don't want to take it, they threaten you. And if you forgot that, in fact, you are at home and the boss is you, you messed up. So, but you can only do that if you have a plan. You can only do that if you have a good legal framework and if you have a way to approach them. Because they are not bad people. They just believe that they understand better than you and your country. And you need to put order in that. You can only do that if you have the legal framework, the strategies, national strategies. If not, you are going to be on a hotspot. Sometimes it's not bad to be on hotspot. It makes some pili-pili in life. Sometimes it's not good to be on hotspot, and it delays execution. So, coordination of partners, legal framework to do that, also the tools to do that, and integration. Meaning, in some countries, you have this structure that gives this type of health, and after that, let's say, a woman with mental health problem, HIV, and malaria, who has to deliver. And she has to go in 3 places to have a good follow-up, integrate and centered to people. Don't accept that this is my money, this is my lab, it's HIV. No? This is the lab of the people. Bring your money, bring your instrument, we are going to work for the people. So, geographic accessibility, financial accessibility, information and transparency, and quality. So, when you design a pyramid of care, at the bottom you have the village. In each village, you have 4 community health workers now. 4 village is a cell. You have a health post and a nurses without a degree. 4 cell, you have a sector. First health center with nurse with a degree, no doctor. 4 to 7 sector, you have a district with the first place where you find a doctor. And after that, province where you have specialists and teaching hospital when you have subspecialties. With a pyramid like that, it goes with equity. And there are some portion of the population that are not served the first year, even sometime 20 years after. But they know that you go by the need of the people, and that one day they will be served. It creates trust, and it gives you support to do that. And this is the map of Rwanda. You can see every place a woman can deliver, and where there is nothing like on the right and the left, it's the national park and the national forest. So the last one is support, and in that support I put the national health insurance and fighting stigma, etc. So I don't have to tell you that better health brings better active population and better growth of the country. This slide is important because it's all about equity. You can see that on that part, that in rural area, you have 5 times more reduction of mortality, child mortality, than in cities. So that means you have managed to reach the majority of the people and the most vulnerable. When you do that, the money you invest in the health sector produces far more. There is a great study done last year by UNICEF about investing in the vulnerable brings 4 times more in return. But in Rwanda, by still having less financial capacity than our sister country, we have done better. We have the best kids vaccinated on earth. 93% of our boys are vaccinated against 11 vaccines, and 93% of our girls against 12 because they have HPV vaccine. This is the result of a system approach, of an approach centered to the most vulnerable and to the people. So this is the study of UNICEF. You can advise you to read it. But another outcome, you can see that for each life saved in Rwanda, you invest less money than in other countries because you have created the system that allow that. So the private sector, the majority of you will be private sector, probably. You have responsibility in health sector. And in our countries, a big responsibility is about counterfeit. When 30% of the drugs in Africa are counterfeit, we may be very afraid to be sick, even with the best system. So, there is a lot of hope in Africa. The 10 fast-growing economies are in our countries, with S. And together, we can apply those principles to provide better care. And I don't know if you have understood that this approach is a business approach. I think I'm going to pass those slides, but there is this one no, because you need a comprehensive government. I talked to you that we need to work together as sector, health sector, education sector, gender and family, but also transport sector. And there are 3 clusters of governance in Rwanda: social cluster, economic cluster, and also social, economic, and governance sector. And those sectors are working together. And when we need somebody from another cluster for taking decision or implement something, it's easy to go as a team. Meaning the Minister of Health knows exactly all the policies that the Minister of Youth has are ready to propose to the cabinet. And the Minister of Gender makes sure that those policies contain everything for gender equity. The Minister of Health makes sure that health is concerned, etc., etc. Take a little bit more time, but when it's done, it's far more rapid to implement. Now, you make sure that in all the documents, all those ideas are reflected. It can be the Vision 2020, the economic or poverty reduction strategy, whatever. Make sure that it's integrated. Of course, as I told you, will have opposition, and we have had opposition. This Maurice King has, for example, those people who say for Africa, too expensive, too good, no need. In the year 90s, he has said that it's not because we can give oral solution to radioactive kids that we should give that to Rwandan kids, because they are promised to a miserable life. Published in the Lancet. Can you imagine that? And now we are a bright country. But even though, it's insane to publish that in a scientific journal, peer-reviewed. That means at least 7 people have read that before you published. You also remember no antiretroviral for Africa because they don't know how to read a watch. And today, what happened? In Africa, we are more compliant than in this country. Because of what? Not because of better doctors, because of what we call social capital. You know what social capital is? That means if I'm HIV positive and I'm sick, I will always have a sister or a mother or a brother that have to be in the hospital with me. And because I love that sister, that brother, that mother, I'm going to take my medicine not to be sick. Social capital. That doesn't exist so much in other countries. Community health workers also are key in social capital building. This slide shows you that we have double results in viral suppression with HIV, with generic drugs, with less infectious disease doctors and nurses, and very few labs. So there are things that are not linked to development, but the way you do business. And this to show you that when we start to implement HPV vaccine, we had people who say, oh, no, they are crazy. Is this in the best interest of the girls? Like, you have this opportunity to save people for one of the more deadly cancer, and you are not going to do that because it's a tool that is too sophisticated. So, I don't know if there is time for Q&A. 5 minutes? I just want to make sure that you understood that we have to work on our availability, acceptability, equity. Equity in finance, equity in geographic distribution. It's not because we have everything, we miss a lot of things, but at least we share what we have. And no mercy for lack of quality. Create a system of peer review and of monitoring and evaluation of the care given by the professional to make sure that the patients are well served. We need to continue. We have 90% of adherence to health insurance, but we need to continue and to diversify access to other type of care than what is proposed now. So, need vision, need data, and need flexibility to make sure to transform your legal framework, everything when needed. And don't try to come like experts who bring things like that just to show you that it's so complicated to do a health insurance. That's not true. It's very simple, apply the principle we talked about. Now, to educate on those principles, we have created a university in the north of Rwanda. We have put the university in the north of Rwanda because the major high education is given in cities. After 4-6 years, you ask the people to go and work where the people are in rural area, and they say, I will not have my pub, my friends, my cinema. I'm going to die and have a boring life. So we decide to put the university in rural north. And we want to educate the next leaders to provide quality care, but also to be capable to build the health sector. Meaning, if I go like I came in Rwanda, when the health sector was destroyed, And without knowing how to rebuild it, those people we educate will know how to apply the 5S and to rebuild a health sector. So, in the middle of the community, we focus on One Health. You know that the majority of diseases that we have are linked to environment, to animal, and to human health. However, in majority of the medical school, we don't teach it. We want them to be leaders. They can be the next minister. They can be the next doctor in a village, but they will be leaders and transform the sector where they will work. It's based on implementation science. You have the hard science that discover a tool. Private sector put money, transform that in a medical device, but it's still not health. You need to bring that to the people to transform that in health. And I want to recall the HPV vaccine. Since we have started 8 years ago, more than 93% of our girls are vaccinated. Before, it was sleeping in rooms or in storage and not really used. We have graduated 2 classes, Master in Global Health Delivery. And this is the campus. We have inaugurated our house the 25th of January, beautiful, in the middle of nowhere, with our president. Thank you.